Good morning. My name is Amol Nirgudkar. I'm the CEO of Patient Prism, and we're back again in Patient Prism Studios recording some new content. This week, the topic is really staying safe within your dental practice. And we have one of the foremost experts in this country, Linda Harvey, who's joined us to give us some great insights about safety, infection control, as we start reopening the practices now. And most of us are getting excited that dentistry is going to reopen back again, hopefully sooner than later. Some states have already done that. We wanted to bring in an expert like Linda, who basically has spent her entire career advising dental practices through consulting, through her speaking on infection control measures, on compliance measures, on OSHA and HIPAA. Linda is the founder of two companies, the Linda Harvey Group, which does a lot of speaking around the country. If you've been at conferences, she's always speaking there. And the Institute of Dental Compliance and Risk Management, which actually helps practices comply. She speaks nationally. And I think this topic of what you do, Linda, today is so much more relevant than ever before, right? I think since dentistry started, I believe, because we didn't have the dentistry and the Spanish flu in 1917, at least not at what it was. So I'm excited to have you on. Thank you for coming.
Thank you, Almost. My pleasure to be here as well. And this is such a relevant topic, as you mentioned. We've been practicing infection control techniques for many years, and some of us, including myself, remember the days when we didn't have gloves, masks, and glasses. So this is the next big transition for us. And there are many generations that are following us that did not experience that. So they've never known dentistry in the wet finger environment. And now we're going to be learning dentistry and protection again in a new format.
You know, absolutely. This morning, Harvard came out with a study this morning where they were looking at, what people's attitudes are towards reopening the economy. Right. My question one is, and it kind of started some thoughts in my mind about how should dentists answer this question? Is it safe to see patients? That's the first question dentists need to ask. I guess they need to answer for themselves. But how do they answer that?
Well, that's a two-part question, Alma, because they do need to answer it themselves first to feel comfortable for them and their team. So one thing that I've been talking about these past few weeks is being sure that you instill the confidence in your staff first and then your patients, so they will want to come back. As a patient myself, I've been receiving the emails from our office, who happens to be a client, and I'm following their trend, and they're working with our advice to get that message across. So I think in order to feel safe, we need to be mindful of all the different regulations, state, CDC, and federal, so we can study all that. And as I was picking up earlier, I've had a pile of papers here, all the things that I've been studying just to keep up with it, just like everybody else, being at endless webinars and trainings and conferences and group chats with peers.
But the question is, you still have to answer, is it safe to see patients? What do you think? Is it safe to see patients today?
Yes, I think it's safe to see patients today, provided we have the proper PPE and that we don't rush back to practice. We take our time to prepare and have the office ready, have the team, everybody on that same train, if you will, of reopening, so that we're comfortable and we're not rushing back, because we're all eager to get back to normal. Because
right.
I go to the grocery store with a mask on, and I don't feel, there's no joy in going out. So we want to get back to that joy in life and the joy of taking care of our patients and being with our team members. And so I think we just have to take it slow and steady together.
But the answer is yes. That's a great answer that everybody wants to hear, obviously, provided you have all the ducks in a row. That leads me to the second question is what are some of the changes that the dental practice should be making now to get ready to see patients?
So many offices have been leveraging technology for a while. So our communications with patients are going to continue to leverage that even more so, whether it's, teledentistry to some degree. But now we're using our patient communication tools to pre-screen patients before they come. So that step, I think, is going to be with us for a long time. So that change. And instead of just simply reminding the patient a week or the day of or the day before their appointment, now we're going to be we have been incorporating that screening process. But remember, the only patients that have experienced it during the past 6 or 7 weeks have been the patients that have been in for an emergency visit. So we have to, inform and prepare all the rest of your patient base of what that's going to be. So that's only one small change. The next change is, what's the patient going to see the minute they walk to your front door? Where's your reception room going to be? Is it going to be in the parking lot now? Or are we going to stagger patients so we just have a few people in the reception area at a time so we can maintain that 6 foot, social distancing? And all those factors, Amol, are going to depend on the practice setting. How large is the reception area already? Or is it a small location where maybe you only can get one patient in at a time who's in the waiting area? Right. And the temperature taking is going to be continuing. And that's something that the patients who came in for emergency visits experienced, but nobody else has experienced it. So those are some certain things. So just that whole getting the reception area ready to greet the patient is going to be a little different. Perhaps instead of that beverage station, now it becomes the sanitization station. And some of our clients and I have been brainstorming ideas for putting wonderful little notes of positive welcome statements on the outside the door, and then inviting them to visit that sanitation station when they come in.
Absolutely. And what about like scheduling considerations? Are they super important now?
More so than ever, because take a look at our pediatric and our orthodontic friends, where they just have a high volume of patients, and those orthodontic appointments are typically very short. So they're going to probably slow down. I don't even want to guess what percentage. I'm sure less than 50%. Maybe it will be down to a third of what they saw. So we can get patients moving forward in a flow, and they're not all jammed together, because, in those two settings, they're coming with parents and siblings. So it's not just one patient alone that you might see in a GP practice.
Right.
So we have
right.
those, yeah.
And you may need to tell your patients that, obviously if it's kids, just bring just one person, come there, please wait outside. There might be some protocols associated with that.
Yes.
I always think about liability as practices are getting ready to open. Do we think we need to get patients to sign some waivers with respect to the COVID risk, so that if we protect our practices, or is it even is that considered at all?
But that has been considered, and I've seen that on some of the social media blogs and newsletters and things, and I think it's not really necessary, in my humble opinion. I have not seen any legal experts coming out and recommending it, because it's probably like that informed refusal for x-rays or referral isn't really going to make a difference. They could walk into the grocery store or anywhere else at this point and contract it as well. So I think, yeah.
And I'm hoping the courts are going to be a little more lenient towards the health practitioners, because here you are, taking care of somebody. I mean, if somehow, somewhere, the patient's exposed, it should not come back on you.
Another important point to mention about that whole reception area, and then let's just say welcoming the patient and getting them triaged, that information has to be sure that you get that in the patient record. The screening questions, their responses, their temperature, that all needs to, be imported into the patient record.
So there needs to be some sort of a workflow template that you've designed, which I know you've been helping your clients with, to make sure that that process is set, so that it, from all standpoints, just from a, letting patients know that, hey, we've got a system in place. PPE changes. What about PPE changes? I know that's just the biggest elephant in the room right now. It's PPE.
Oh, it is. And everybody has a different opinion on it as far as team members and what they feel the needs to be safe. And this is where I'm using kind of the phrase, having that collaborative conversation with the doctors, the dentist employees, entire staff, about what everybody needs to feel safe and how reasonable is it, and then align it with the CDC guidelines and your state Dental Practice Act. There's about 12 states, I'm guessing more or less, 12, somewhere in that number, that have adopted the CDC guidelines in their entirety into the State Dental Practice Act. And in some states, the wording even says, because we know the CDC guidelines for dentistry were published in 2003, and they haven't been really updated since then. So I'm sure they're going to be updated very soon. It's just that we all went it yesterday, but we can't have it now because there's still more information that needs to be learned and gathered and researched. So that being said, the way some of those laws read, Amol, is that 2003 guidelines or their successor. So I'm not an attorney, I'm not a regulator, but could that imply that means you better be following the interim guidelines? I would do so to be safe. So the PPE changes are primarily wearing that N95 respirator mask and then having a face shield, changing the gowns in between patients. I was listening to a whole conversation on booties and headwear this morning. That's kind of cute, but booties and bonnets now for adults and not just babies, right? So,
that's right. Exactly. I mean, and it goes on and on, right? I've heard about the the rinses that you do, chlorhexidine rinses or one of these chlorine dioxide rinses. And I've heard about these high vacuums.
Extra oral
I don't know at what point do you really, I mean, obviously we're dental practice are not making money right now. The production is not going to come back right away. And here they are having to spend all this money on $5 for a nine. And we had a client yesterday spent $5 for 1,000 masks. That's a lot for N95 masks because they're not available. But as far as PPE changes go, from your standpoint, um, um, compliance is tough because there's no standard guidelines. You got to go by the CDC 2003 stuff. Okay, great, but if it's not relevant and if it's too onerous, then where do you draw the line? I'm hoping the regulators will be a little bit more lenient towards practices that can't really obtain PPE.
Exactly. And so the CDC interim guidelines do talk about the fact that if you don't have, the N95 respirator mask, that you can wear a surgical mask with a face shield. So for us in dentistry, that with an aerosol, that would be a level 3. But if you're doing, hygiene check, or orthodontic, just a quick, wire change or span change or something simple, that you may not need a level 3. So I think we have some options now. It's just a matter of each practice trying to make sure they're making the best decision and not dropping the standards too low, so then the staff aren't uncomfortable as well.
And that's really important.
Consider that, there could be some things about our staff that we don't know with their health history, and there could be now, because of all the changes, they may have relatives or they may have a patient or spouse or partner at home that's a high-risk category. I'm thinking of someone older that I know who needs to work from home. She's older in age, but her husband's waiting for a transplant. So that would be someone they've set up to work from home, which is a great opportunity that she can do that.
Right. So you mentioned some tools, and we'll list them on the screen later on. But where dentists can go to find information about this in terms of the CDC. Will you give us a list of places where they can go to?
Sure, absolutely. So when we talked about the CDC, a couple of resources that are there. One that I really like is the pyramid of the hierarchy of controls. That helps us to recall, what we're focusing on, and it's an inverted pyramid where the bottom, the apex is now at the bottom, is the PPE, and that's really the lowest level of protection of all the aerosols and transmission, even though that's the one we're focused on the most because we can't obtain it. And then we move up that hierarchy to work practices and engineering controls, and that's where the doctors are beginning to look at, do I need those extra oral suction devices? Do I need more sophisticated high vacuum from my hygiene team? And do I need to do the aerosol control purification systems and HEPA filters in the office? So that's where that whole hierarchy is, and that's a great way to look at how we're controlling things, and that helps to make the whole environment safer for everybody.
Is it going to be important for us to move up the hierarchy in order for everybody to feel safe to go to dentists again?
I think we're going to be looking at that to some degree because, there's 3 things we know about this virus. It's a novel virus, it's easily contagious, and we just, we don't have a good vaccination. The testing seemed to be accurate. I'm not scientific enough that I've studied that detailed. I will admit that. However, the rapid tests that have been approved by the Food and Drug Administration have been approved under that emergency usage authorization, the EUA. So whether they are here after the fact, we hope so, and we hope they're more sophisticated and that they go through the proper channels. But there's actually three companies that have been approved for the rapid testing. We primarily hear of one because they're the most popular, but there are actually 3 different devices. And then more tests and research is coming out with other products. So we just have to follow that and see how that comes. And so once that becomes more sophisticated, then we'll feel like we're more secure because we have a vaccination, we have treatment for it, and we'll feel like this is under control. But until then, like you said, we need to think about how are we going to control the aerosols. If we don't have the proper PPE for, let's just say for the hygiene setting, then at that point, the hygienist should refrain from using aerosols. And that means the ultrasonic. So, wow. Yeah, and that's difficult because, that's such a routine standard of care now. And then there are many hygienists that's their mode, they primarily rely on ultrasonics. So, and then there's a certain population in the hygiene community that maybe have some, ergonomic or some other issue that they really have to use it. So we're all trying to bend right now and kind of be flexible. So I think we all need to all be collaborative in that endeavor.
There's a lot of information right now. Facebook is just there's groups that are talking all day. We have more time to be on Facebook nowadays anyway. And there's all these dental groups talking about all sorts of things. There's conflicting information everywhere. From this compliance standpoint, I mean, obviously we don't want to rely on stuff that we see on social media. Um, what are some of the things that you've seen that have been interesting for you as you go through your groups as well, from just a risk management standpoint? Anything interesting?
Quite a few things. It's amazing that some of the groups that I've been in and participated I've seen where team members and staff and doctors particularly didn't understand the different levels of mask, and that we have always had, or there was confusion and still referring to the term universal precautions, when actually the CDC updated that back in 2007 to become standard precautions when they added cough etiquette and a few other things to those standards. So I think there's just that misperception because we've taken it for granted. And I'm going to use an analogy that success mentor Darren Hardy had in one of his daily videos this week. And it was the branch of complacency. And so that branch has been cut out from underneath us. And just like the bird that was sitting on that branch, we're having to fly real fast and we're flying by the seat of our pants.
Right.
Trying to figure out. So it's kind of moved us now. And so one good thing, if we can say that, would be that we're learning so much more. So team members, doctors, that didn't know or understand some of the finer points was like, okay, get whatever mask you need. You just place the order, I'm fine. Now they're beginning to understand. And we even know to a higher degree when I can answer a question and explain to the doctor why and what's the difference between a level 2 mask and a level 3, I feel good about that because now they can make a better decision for themselves and help their team as well.
And I think communicating that with your patients is also going to be important, right? Because patients need to feel safe even before they come into your office. I mean, when you have the education and the processes built in, which can be clearly communicated with your patients, either on the phone or when they come in, I think patients are going to be more likely to say that, I feel safe going here. It's no problem. They're going to tell their family that's okay. And I think that's how we start that's how we start this industry again.
Yes, and you know what? To piggyback off of that, the next step that teams and doctors should be mindful of, especially so, is how are you going to answer those patients' questions? I've heard questions from my colleagues that have gone to, say, a medical doctor, and they've asked questions. And I remember another colleague in the consulting world, infection control, Karen Dahl, wrote an article a few years ago about trying to help her mother. She went to visit her mother and was calling around dental offices trying to find a new dental home, and nobody could answer her questions. She wanted to know what the sterilization processes were, of course. And so we become defensive in that in the former days. And now we have to be able to answer those questions very confidently and stand up straight and just have a good answer. And if we don't know, that's a good question, Mrs. Jones. Let me get the answer for you. And we can at least be just that same customer service aspect needs to be here more than ever.
And I'm assuming through your institute, you've got a plan and a package that you can help dental practices with to kind of deal with all these issues, right? Because I can't do this at home, right? If I'm a doctor, I can't do this. There's too much going on right now, and I can be complacent. You're right. Darren Hardy was right. It's the complacency factor's got to go away and thrown out of the window, because maybe I have a lackadaisical mindset towards infection control and safety, and I was okay pre-COVID times. But today, it's your team, it's your patients, it's yourself, all of that stuff, and you got to dot the I's perfectly in this area in order for you to even survive, let alone thrive post-COVID.
Sorry, go ahead.
No, sorry, go ahead.
Well, on one hand, we can make the argument or debate that, there's not a lot of disease transmission that occurs in dental practice because we don't see it in the news headlines, although there's been a number of dental offices shut down, for infection control issues. It doesn't really, maybe it pales in numbers compared to our medical counterparts. But on the other hand, our medical counterparts have reporting guidelines to state and federal agencies where you have to report infections and you have to report, patient satisfaction, surveys and things that are tracked and trended that we don't have in dentistry. So we really don't have a lot of data to say that, yeah, it was okay in the past when you didn't wear your jacket because you were too hot. And it was okay in the past when you ended up having your mask down like this. And it was okay in the past when you pulled down the mask and wore it under your chin in front of your patient. So those kinds of things, while you didn't end up going home sick, but you still went home with, spray and splatter and, contaminants and microbes all over you probably.
it was okay to tell your people to take their scrubs home and launder them themselves, right? It was okay at that time. Now maybe it's not. That brings up another interesting question. Is what is your obligation if a team member or, or let's say you've opened up your practice, and then either one of your team members test positive or one of your patients, let's say you have some testing mechanism, patient, we figured out later on that the patient was COVID positive. What is your obligation to your team and your patients? What kind of communication protocols you need to observe?
So that's a whole nother conversation of itself. It's a very good question. So what I'd like to do is show everybody, the screenshot of what those interim guidelines are, because there are protocols from the CDC on how to manage this if you or your team members become COVID positive or a patient, and how to go through the testing and at what times you should come back to work. So there's set protocols on that. So to help distinguish that from the patient's perspective, we are recommended from the CDC to contact the patient 48 hours after their visit to ask those same questions to be sure that they weren't in that 2-day window of time before they actually developed symptoms, but they were positive in shedding the virus all over your office. Now, if you wore all the proper PPE, then probably there's not going to there'll be a lower risk of transmission, but that might be something that would be something that's trackable, because that could be concerning. And then likewise, we're asking our team to voluntarily, participate in the take your temperature twice a day when you come in and before you leave, let us know how you're feeling. And we know recently the CDC has acknowledged about 3 times as many symptoms as originally thought. It's not just fever and cough or difficulty breathing, but it's
Right.
that new loss of sense of taste and smell, and muscle aches and fatigue. And who among us doesn't have a bad night's sleep and feels tired? But that's different from fatigue illness. So making sure that we monitor those, and if we just make our good faith effort, I think we have a strong protocol. But we'll refer everybody to the CDC guidelines for that.
But I'm assuming that we don't have to just alarm our entire patient base that, by the way, we had because it's not relevant, right? That doesn't affect their health, because otherwise everybody's going to stop coming to our office.
Yeah, possibly not. I think we would rely on what the State Department of Health would tell us. Well, what I've seen here in Florida, where we're located, is that dentists aren't listed on the list of providers that are required to provide report to the state certain infectious diseases. However, I would still call and get advice from them. And if they advise you to notify patients at that point, then I'd let the experts make that decision.
Well, that's great. I mean, I think there's so much here. I mean, we could go on for a whole day and do a webinar on all the different things they have to do. I think the best way, and I have recommended this in my other webinars, is they hire somebody, you or somebody like you, to put these things in place today. Don't wait a month from now. Do this today as you start opening. If you haven't opened up yet, put some of these trainings in place with your team members. Put some patient protocols in place, and err on the side of caution, so that one, your team members feel safe. Number two, your patients feel safe, because now you have communicated with them all the things that you've been doing, and you have some sort of a playbook. You almost need a playbook right now for all the compliance and infection control, not just to because otherwise your business is not going to survive. Because if people don't feel safe, it doesn't matter what specials you can give away free dentistry and nobody's going to come, because the safety is really important. How do people contact you? Or we're going to leave this, it's up on the screen. The best ways to reach you is?
Well, they're welcome to drop us an email, and that's riskteam, R-I-S-K, riskteam at lindaharvey.net, or call us at 904-573-2232.
Wonderful. And then we're going to leave your contact page, lindaharvey.net. That's another way to get a hold of you. But I encourage every single one of our listeners to reach out to Linda and put a plan in place. Whatever that plan may look like, it doesn't have to be super extensive. It could be a simple plan, but you need a plan and you need a playbook. And that's going to be the path for you to open up safely and make everybody feel safe. Linda, what a pleasure it has been to talk to you. And the timing of this couldn't be more appropriate. As we know, changes could happen in the future, and we'll most likely invite you again if something changes. And I thank you for agreeing to do that as well. So on that note, we'll leave some of the contact information on the screen. And thank you, Linda, for coming here today.
Thank you.